Hello, our names are Esther, Julie, Ava, Anu, and Krista, and we are senior dental hygiene students speaking on the benefits of public water fluoridation systems and advocating to implement fluoridated water in the Niagara region. The predominance of dental cavities has been a growing issue within both children and adult teeth. There are many factors that contribute to these problems, such as lack of oral health education, lack of receiving preventative care, and dental care affordability. Studies have shown that fluoride has been effective in reducing the risk and progression of dental cavities significantly, especially for early childhood caries, which are cavities that children can acquire on their baby teeth. Although baby teeth are assumed to not be a concern to many, as they are expected to fall out, damage or early fallout of these teeth are seen to affect the oral health and future teeth to come in. This has been a concern as the incidence of early childhood caries continue to increase, which calls for further preventative measures such as water fluoridation. So, what is fluoride? Fluoride is a natural mineral that helps prevent cavities. It strengthens the outer layer of the tooth structure, which is called the enamel, and makes it more resistant to acid attacks caused by lingering food, drinks, and bacteria. So, what are the benefits of fluoride? It first prevents tooth decay. It strengthens your enamel through the process called remineralization. Studies have also proven that it is safe and effective when used in appropriate amounts. And lastly, it could also be used by everyone, no matter the age. As part of our profession, it is important for us to advocate for everyone's oral health. Fluoride has shown to be an effective preventative measure. A beneficial method to distribute and implement fluoride to all people would be through water fluoridation. To reduce the incidences of dental caries, we believe that the oral health of the public will benefit from implementing water fluoridation as a preventative measure. This will improve the health of the public by going against barriers such as dental costs, support equity by being provided to everyone no matter social economic status, can be accessible and widely distributed to the general community, and will have an influence in improving oral health outcomes. Dental hygienists use the process of care to better understand our clients and as a means of creating a client-focused care plan to improve or maintain their oral health. Both are used to promote individual health and overall community well-being when combined. As we go through the process of care, we often identify and diagnose issues affecting oral health, sometimes outside of the individual's control. Some broader issues can be lack of access or even cost barriers. These discoveries tend to lead to advocacy to improve policies, programs, and public awareness in order to support change and health equity. We recognize the barriers and challenges that many people face in terms of their dental care and the rise in incidences of dental caries. With our knowledge and strong evidence through studies that support the benefits of fluoride in reducing the risk of dental decay and promoting oral care, this empowers us to advocate for water fluoridation so that we may better address these barriers and challenges.
Currently, the Niagara region does not have a fluoridated water system. This means that residents must rely on other sources of fluoride to help prevent cavities. Some everyday foods do contain small amounts of fluoride. It is also commonly found in toothpaste and mouth rinses. Additionally, dental professionals can provide fluoride through treatments such as gels or varnishes. However, these alternatives are not always accessible to everyone, especially those facing financial barriers. Water fluoridation would offer a consistent and effective way to deliver fluoride to the entire population, regardless of socioeconomic status. The main stakeholders in this issue are the Niagara Regional Community, dental professionals, and the municipal government. The community, particularly children, seniors, and low-income families, stand to benefit the most, as they often experience the greatest challenges in accessing dental care. Dental professionals play a vital role in advocating for fluoridation and educating the public about its benefits. Ultimately, the authority is in the municipal government. Because public opinion often shapes the decisions, collaboration between all stakeholders is crucial to prioritize health and promote informed choices. We are advocating for the implementation of public water fluoridation in Niagara because it is a safe, effective, and equitable way to support oral health. Many members of the public are either unaware of the benefits of fluoride or do not have reliable access to it in other forms. As future registered dental hygienists, we understand the critical role fluoride plays in cavity prevention and how systemic solutions like fluoridated water can help bridge existing health disparities. This issue is not just about individual responsibility, it is about public health access and equity. The intended result or goal of our advocacy is to educate the public about the science-backed benefits of fluoride and to address any misinformation or skepticism surrounding its use. We hope that through awareness, Niagara will consider implementing public water fluoridation to help protect all populations from preventable dental disease.
A great example of how water fluoridation has shown to contribute and benefit a community is the reintroduction of water fluoridation in the city of Windsor, Ontario. According to the articles, the community of Windsor, Essex had decided to re-implement fluoride into their water in 2022, since its discontinuation in 2013. The Windsor Essex County Health Unit oral health reports during that time found that children with decay and or requiring urgent care in 2016, 10, and 2017 increased by 51% in comparison to when the program was implemented in 2011 to 2012. These stats suggested to be related to the discontinuation of the program and the increase in children being eligible for topical fluoride due to their oral health status. Overall, bringing up the concerns and re-implementing fluoridated water.
In spite of its benefits, advocating for fluoride can prove difficult due to various barriers and challenges. There is often public misinformation and misconceptions. Although research proves fluoride's reliability at safe levels, some people continue to believe fluoridation causes health issues like cancer, bone disease, or developmental problems. Some have concerns over the cost of installing and maintaining fluoridation systems, especially in small or rural municipalities where they may struggle to fund the change. Despite all this, the benefits of fluoride far outweigh the concerns. It's a common myth that fluoride is harmful and toxic, but the fact of the matter is that in appropriate amounts, fluoride is safe and beneficial for your teeth. At worst, too much fluoride during childhood can lead to light discoloration on the teeth called fluorosis. The annual cost of adding fluoride to municipal drinking water in Ontario ranges from 77 cents to $4 per person each year depending on the community size. Community water fluoridation, the most cost-effective method of preventing tooth decay with per capita annual benefit, ranges from $5.49 to $93.19 per dollar invested.
The first article, Water Fluoridation in Canada, past and present, emphasizes the benefits of community water fluoridation, especially in reducing early childhood caries, as seen in Brantford, Ontario. Unfortunately, access to fluoridated water varies across Canada, stressing the need for advocacy to establish equitable access. Health Canada and the World Health Organization highlight the benefits to public health with fluoridation, especially in undeserved communities. Change proves to be difficult because of opposition due to health risk and ethical concerns. These matters can be solved through advocacy, addressing these issues, and promoting evidence based policies to ensure equal access to preventative oral health care.
The second article, The Story of Fluoridation, provide a historic and scientific validation of water fluoridation. It began with Dr. Frederick Mackay observation in the earlier 1900s. The high level of fluoride in drinking water resulted in fluid cavity. Intentional fluoridation first occurred in Great Rapids, Michigan in 1945. The following study have shown a 25% reduction in tooth decay in fluoridated community. The article also does over concerned about dental fluorosis, emphasizing that regulated amount of fluoride level effectively prevent decay without risk. Scientific backing further show that water fluoridation is a cost-effective public health measure that should be advocated for.
The third article, Why Fluoride is Necessary for Public Health, goes over an interview with Dr. Charlotte Lewis, a pediatrician at Seattle Children's Hospital, who emphasizes the importance of fluoride in reducing tooth decay and improving overall health. Though the article comes from the United States, the information is still relevant to Canada. Dr. Lewis goes over common health concerns about fluoridated water, but highlights how research consistently shows it is safe and beneficial for dental health at the standard community level of 0.7 milligrams per liter. She also advises against removing fluoride from systems that have already implemented it, as it may lead to an increased incidence of dental issues, especially among vulnerable populations. Advocacy would assist in the implementation or continuation of water fluoridation as a critical public health measure.
To conclude, we believe that Niagara Region Water System should implement fluoridated water for the dental health of its inhabitants. Community water fluoridation is a safe, cost-effective public health strategy that has been proven and significantly reduced tooth decay. It is especially important for low-income, rural, and underserved population and promote equality in oral health. Based on the evidence from our research, we believe that all communities in Canada should have access to fluoridated water. As a future RDH, it is part of our professional duty to advocate for this cause. We aim to continue to promote oral health by educating the public, contributing to policy change, and supporting water fluoridation system across the province as a commitment to public health. When we support prevention, we reduce long-term health care outcome and costs and improve the quality of life for everyone. Our advocacy effort hope to convince community that fluoride in their water is not harmful but beneficial for their oral health. Together we can help build a future where dental caries is a minuscule barrier to health, confidence, or opportunities. Thank you for listening to our presentation.